Okay, looks like we are back fully. I'm not sure what was going on. Sometimes Facebook likes to, hate on your boy a little bit. I am yours truly, Dr. Barry, board certified internist, founder of drpierreblog.com, host of the Lunch Learn with Dr. Barry podcast, and bringing you a late and light edition of the Lunch and Learn. So, we're just going to pretend like it's lunchtime. Right now, today was crazy busy for those who, let's say this is your first time catch me. I am in South Florida. And South Florida right now, we're getting ready to deal with Hurricane Irma. Don't necessarily know too much because been in the hospital working all day. And it seemed like today everybody was coming to the hospital to get admitted. Like everybody's sick like right now. And I fully expect more and more people to keep on getting sick over this time being. So definitely a crazy day in the hospital. So I didn't have a chance to kind of break away and, do the Lunch and Learn this afternoon. So we're going to do it today, right? So that's okay. We've done a couple of these things at nighttime and, regardless of when we give the educational lesson, as long as you guys learn it and take it, we're good to go with that. So this is episode 51 of the Lunch and Learn with Dr. Barry, and we're talking about sickle cell disease, and we're going to be talking about why, of course, sickle cell disease is important. Of course, everything I tell you in one way, shape, or form is important to somebody, right? Because again, we're talking to, especially we have a pretty wide range audience of those who kind of read the blog or watch the videos like you're doing right now, or even listen to podcasts, right? So I try to make sure, I kind of reach out and touch everyone's topic one way, shape, or form, right? So today we're talking about sickle cell disease. Why? Because it's important, because it's September, and September is actually National Sickle Cell Awareness Month, right? And in the notes, what I'll do is I actually post a link of a blog I wrote last year about sickle cell disease, right? Because it's such an important disease, especially not in sense of the numbers game as far as who is affected by it, because there are a lot of people, but it's not as many. It's not like diabetes or hypertension. It's not that many people are affected by it, but it is a disease that whether you're an inpatient, I do inpatient now, whether you're inpatient medicine, whether you're outpatient medicine, it is something that you'll run into. All right. It is something that you'll kind of run into. So always want to be very important, be very mindful of, disease, especially being the fact of who gets affected, right? So again, I talked about how this is National Sickle Cell Awareness Month. And again, usually a lot of times, especially with these disorders that have their own month, which a lot of them do, a lot of it is really to kind of help spotlight and bring attention. And, of course, if, especially in a time like this, bring awareness, bring donation dollars, everything above, all of those choices above, right? There's some of the reasons why we even spotlight some of the diseases we spotlight. But important, especially when it comes to sickle cell disease, right? It is a genetic disorder, right? It's actually, in the United States, the most common genetic disorder, period, right? The most common genetic disorder, period. And so it's something that's personal for me, right? It actually affects, 60 to 80%, right? African American or Black folks, right? So again, this is something that if anything, right? If there's any reason why I should be focused on it, I got to be focused on that, right? 60 to 80% of those who are affected by sickle cell disease are Black or African American, right? So again, it's another, point of, matter of why we need to really be talking about sickle cell disease, especially here on the Lunch and Learn, right? We're going to be talking about sickle cell disease. I'm going to give my points. We're going to be talking about what is it. We're going to be talking about who's affected, some common complications from sickle cell disease. I'm going to be talking about both outpatient and inpatient, and then some treatment. And then tomorrow on the podcast, because the podcast will drop tomorrow, we're going to go into a little bit more elaborate detail about sickle cell disease. We're going to talk about the importance of it, especially in my personal life and how it's affected me personally, the way I train, going all the way from medical school to residency to even now as an attending, and how do I face it on a day-to-day basis even now. I would say, especially, and I'll just caveat, give a little tip, little hint on what we're talking about on podcasts. We're going to be talking about how now in the hospital setting, right? The hospital setting, right? Most of the patients that we tend to see, especially with sickle cell disease, right, are usually coming in some type of crisis, right? So I just want to, that's kind of, a little nibble of what we're going to be talking about, right? Because we're going to be talking about crisis. And then, again, as always, I always like to bring the patient perspective in a lot of these discussions that we have. And again, and for those who've been following who from the podcast standpoint, you know that soon I'm going to be starting to have, people who are actually affected by some of the diseases that we're talking about come on to the show as well, right? And kind of give their personality, right? Because me as a physician, I can only give you, what I feel, or, just talking to them, what they've been, expressed to me. But it's much more important, to have someone who's actually being affected by it, right? Like, imagine if tomorrow's episode, you were actually listening to a person who actually is affected by sickle cell disease, and what do they go through on a day-to-day basis, and trials and tribulations and stigmas and everything kind of above the sun. Because unfortunately, in the hospital setting, there is a lot of stigma associated with sickle cell disease, right? So again, like I said, we'll leave that for the podcast. No guests on the podcast tomorrow, but again, in the future, that's something to think about, especially if you may know someone who has sickle cell disease, and if they want to tell their story, they want to be on the podcast, let me know, and we'll get them on the story here. So we're going to talk about sickle cell disease again. It's an inherited disorder, meaning that you got to get it from both mom and dad. And not to say that both mom and dad have to have sickle cell disease. They just have to have the genetic trait for it, right? They just have to you got to get 50% from mom, 50% from dad. Because if you don't get the full 100%, and we won't go into a full genetics lesson here, right? But if you don't get the full 100% of the disease, especially when we're talking about sickle cell disease, you can't get it, right? You'll be a carrier. You'll be someone who has the sickle cell trait, and you may never have any symptoms whatsoever, right? You may not even know that you have sickle cell trait until you have a child who has sickle cell disease, right? So that's what sometimes happens to a lot of people, that they have a child, the child ends up having sickle cell disease, and then we realize that when we go to backtrack, like, oh wow, I have the trait, and of course my partner has the trait as well, because again, you can't get it one or the other, right? If you have a partner who has no genes of sickle cell disease, and even if you have sickle cell disease yourself, that child can't have it, right? So your partner has to have the trait, and both partners pretty much have to have the trait to give to the child, right, for that to occur, right? So that's kind of the crux of that, right? And sickle cell disease, right, it is a disease of the blood cells, right? In particular, what we call hemoglobin. And hemoglobin, in the grand scheme of things, from a normal standpoint, if you want to think about it, kind of helps carry your oxygen around your body, right? Like that's its job, right? It's like this. It's like the carrier to help get oxygen from point A to point B to point Z, right? The problem with patients with sickle cell disease, right, is that car, right, or that package, that whatever you want to think about it, is not working, right? It's malfunction, right? It doesn't carry as much, right? So if you're normal sickle cell disease, normal hemoglobin, cell let's just even number. Let's say if it carries 5, cells of oxygen, right? Just say 5, whatever. And you have a patient with sickle cell disease, right? They may be only to carry 1, right? So now you have 1 cell, right, that used to be able to carry 5 by itself, right? Now it can only carry 1, right? So now you need 5 cells from a sickle patient, right, to do the same job as 1 cell from a non-sickling patient, right? And this comes into play, especially when we talk about how long, right? Like how long the blood cells last in the body, right? Normally, your blood cells last about 3 to 4 months, right? Like one blood cell, if your body produces 1 blood cell, it takes about 3 to 4 months, right, for that blood cell to get used up and for your body to have to produce a new one, right? But what happens in your sickle patients, right, which is, and this is kind of, when we talk about the basis, right? When we, again, remember especially when we talk about these topics, right, that may seem a lot, right, from an overwhelming standpoint. We always try to focus here, especially here on the Lunch and Learn, right? We always try to focus on the basic aspect of it, right? Because again, I don't expect no one to be able to take this video, right, and now they know everything about sickle cell disease, right? I don't expect that, right? But I do expect them to be able to take it and have some type of fundamental idea. That way, if they want, they can go ahead and ask questions, right? And that's really the goal of all of these Lunch and Learns, the podcasts, the blogs. So you can go ahead and you can be informed as possible, so you know the right questions to ask when you're sitting in front of your doctor, right? Because that's what happens to a lot of patients. That they go to their doctor and their doctor's telling them a million different things about their diseases, and they have no clue about the disease. They don't understand it. And if you don't understand it, you don't even know how to ask a question about it, right? And what happens? You're like, You take a medication, and then one of your family members asks you, why are you taking the medication for? You say, because my doctor told me to, right? You have no other reason why, but just my doctor told me to, right? And I want you to be as informed as possible for all of your diseases, right? Hypertension, diabetes, cholesterol, sickle cell disease, right? So I want to make sure you guys are fully aware of everything that's going on, right? So again, don't feel too bad if some of these terms kind of jump out there, right? Because it's not, you're not supposed to understand it in the 15, 20, 30 minutes that we talk on these lunch and learns, right? The goal is really to kind of start getting an idea so you can start asking questions of yourself. So that's the most important thing. So we talk about the normal cell lasts about 3 to 4 months. In your sickle cell patients, that normal cell lasts about 10 to 20 days, right? So 10 to 20 days, right? Again, so I already told you, right, that sickle cell usually lasts about 10 to 20 days, right? So I already told you that the normal blood cell usually lasts 3 to 4 months. I've also already told you that the hemoglobin normally carries about 5, let's say 5. We did an even number. It's not the true number. We did an even number. About 5 levels of oxygen, right? But your sickle cell only carries 1, all right? If it only carries 1, right? So I need 5 cells to do the job of 1 normal cell. And not only do I need 5 cells, those 5 cells only gonna last me for about 3 weeks. Then I gotta make more. And for the majority of people do not, and it just happens to everybody, it's not even that important. Your body cannot keep up, right, with the amount of cells it would have to produce just to try to do your normal daily function, right? So that's when the sickle cell anemia comes in, right? Because, you start getting anemic, right? Your body stops producing enough cells to kind of keep up. So you become anemic. And again, oxygen carries the body. Oxygen gives us energy. So if you don't have enough oxygen in your body already, and the cells that you do have already don't work because they don't carry enough and they die earlier, you're more fatigued, right? So again, this is like this is how the pattern kind of starts, right, for your sickle cell patients, right, where they already have cells that don't work, and now the cells that don't work, they die earlier too. So again, so now they're tired, they're fatigued. All of these problems and issues start developing, over the years, right? And this is something that starts when they're little kids, right? This is something when they're little kids and that they have to deal with as a chronic basis, right? Because with sickle cell disease, I don't want to say there isn't a curative method, because there is, but most people are not doing it, right? Because it's pretty much a bone, stemmed marrow transplant, right? Like you got to do all of that, right, just to try to get rid of sickle cell disease, right? So it's not something that readily occurs. So when we talk about our sickle cell disease, let me just give you some numbers, right? So I talked about 60 to 80% of African Americans, right, are affected by sickle cell disease, right? That's about 1 in every 500 African Americans become affected with sickle cell disease, right? 1 in every 500. And just to give you an idea, the next group is 1 in every 36,000, right? So 1 in every 500 babies are born with sickle cell disease. 1 in every 36, and this is African American babies. 1 in every 36,000 Hispanic babies, right, are born with sickle cell disease, right? So like that's how much, right? Like that's how wide the difference is, right? Like that's how much, again, a disease that affects us primarily, again, not only, but primarily is attributed to us. Other numbers, right? We talked about 90 to 100,000 people in the U.S. are affected, right? Worldwide, it's like millions, right? So millions of people are affected by, sickle cell disease all across the world, right? But in the United States, about 90 to 100,000, right? Again, 8%. And again, I think this is a point, right? Because I talked about to have sickle cell disease, right? Especially what most people know as sickle cell disease, you have to have both of those traits, right, from your parents, right? But 8% of the African American population has that trait, right? 8%, right? That's a huge number, right? When you think about, sickle cell disease and the numbers of who gets affected kind of, from to and from, right? So 8% of African Americans are affected by sickle cell disease who actually carry and walk around with the trait, probably don't even know it, right? So 8% of those members, right, are affected by it. So, and again, we talked about it being the most common genetic issue. Some common complaints, right, especially from the outpatient and inpatient, and what's going to get your sickle cell patients in trouble, right? So some common issues, right, is they go into what we call a pain crisis. And why did they go into this pain crisis? Again, if you think about it just from a number standpoint, right? You have these patients who have less blood cells in general, right, and then the blood cells they have don't work. So now their body is screaming for that oxygen that they can't get. So what tends to happen is that the parts of the body that you would normally deliver that oxygen and be all good for, like your muscles, right? They start to die. They start to atrophy, right? So you get a lot of pain and discomfort, right? Because areas of your body is not getting enough oxygen because those sickle cells ain't getting the oxygen to it, right? And another thing, especially when we talk about from a pain crisis whatsoever, when you think about sickle cell disease, right, your normal shape of your blood cell, right, is like, let's say like a circle, right? It's normally like a circle, and it's able to fit through your blood vessels with no problem, squeeze by other blood vessels with no problem. But when you have sickle cell patients, right, and those, and I'm going to put a graphic. In fact, when the link I'll post, you'll see a nice little graphic what I'm talking about. The sickle cells, because they're badly shaped. Remember, like I said, they don't carry the 5; they only carry 1, right? So they're badly shaped. They cannot carry as much as a normal cell. And when they try to move through the vessels, right, they get stuck. They cause problems, and then boom, you're in some pain. You're in some discomfort in that regards, right? So again, those patients are more susceptible to infections. Those patients are hospitalized a lot more. We have patients with, again, the sickle cell crisis, strokes. Again, when I talked about strokes in the past, strokes are just, if you think about a stroke, it's just like a heart attack in the brain, right? There's a portion of the brain that's not getting blood flow, right? So when we go back and think about, those sickle cells that are moving and they get stuck in the area and now blood flow can't get past them, and now you have a stroke, right? So it's not uncommon for your sickle cell patients to suffer from stroke, especially at a very young age as well, too. And again, like 25 years ago, right, sickle cell disease was something that, if you didn't live past 30, right, like, 25 years ago, before, the advancements and, what we know about sickle cell now, which is, again, why we celebrated this month. Most people were dying from sickle cell disease by the age they were like 25, 30, 35, right? Like it was killing a lot of people a lot younger, right? Now your sickle cell patients usually live up to about ages 50 to 60 on average. Again, some live longer, some live shorter, but on average 50 to 60, right? So it is definitely a disease. It's a chronic disease that continues to cause problems from the minute you're born all the way into the end, right? Like it's just and it's a sad disease, right? Especially for people who have sickle cell disease. Especially, again, if you're African American, right, the likelihood that you don't know someone with sickle cell disease is probably low. I just gotta be honest with you, right? The likelihood that you don't know anyone with sickle cell disease is probably low if you're African American, right? Because that's how common it is in the population, right? Again, but not to say that this is only an African American disease, but the likelihood that you won't know anyone who doesn't have sickle cell disease if you're African American, extremely low. So I want you to think about it that way, right? So there's the treatments, right? The treatments of how do we try to prevent some of these complications I talked about for your sickle patients, right? A big thing for them is making sure they're getting their immunizations, right? Their flu shots, their pneumonia shots, making sure they're getting their immunizations, right? Because that's a big thing, right? Again, and I've talked about how my young people who think they're invincible, right? They don't like to get immunizations, right? They, y'all young folks who don't like to get y'all flu shot, so y'all get the flu and then y'all give the flu to the young folks and the old folks who shouldn't be getting the flus. Like we talked about that in the past, right? So, making sure your sickle cell patients get their immunizations is very, very important, right? Also, making sure, when it comes to being hydrated, right? Because, again, remember, blood flow is everything, right? So your sickle patients, especially for those who end up in the hospital, one of the biggest things we do to help treat their pain is give them fluid. Give them lots and lots of fluid, right? Because they become dehydrated, right? They become dehydrated, and anytime they become dehydrated, boom, the sickle cell crisis, right? Because those cells, like when they don't get enough fluid, they kind of shrink up even more and cause problems. So that's, again, another, caveat, especially with your sickle cell patients. Like I said, there isn't anything from a treatment standpoint, right? We're not going to be able to treat sickle cell disease and get rid of it, at least in a grand scheme and like wide scale, because it just ain't gonna happen. Not everybody's not going to get a bone marrow transplant, right? It's just not going to happen, especially because all the stuff you got to do to get a bone marrow transplant. We got to get chemotherapy and all, again, not important. So everyone's not going to do that, right? So that's why it's important to think about when we're thinking of sickle cell disease, or we're trying to think about like how can we treat it. A lot of times we just need to try to treat the symptoms and try to prevent you from going into these crises, right? So there are medications, right? Most popular one most people know is like hydroxyurea. So there are medications that kind of help prevent you from going into those crises as often, but again, it can't prevent you from ever going into it, right? And that's one thing you got to tell your sickle patients, especially for my physicians and residents who maybe start taking care of sickle patients. There's nothing that you're going to do that's going to get rid of the sickles, right? Because sickles is always there. It's a genetic issue. Your bone marrow just keeps spitting out more and more abnormal cells, so there's nothing you're going to do to stop that. But what you can do is stop the amount, or you try to help stop the amount of times they end up in a hospital or they end up in a doctor's office and everything else. So that's, and that's it, right? So that's a nice little general overview of sickle cell disease. Again, we're going to be talking about it on the podcast tomorrow. Tomorrow we're going to be talking about, again, the pain of sickle cell disease, right? Because again, I kind of glossed over it on the video, right? But we're going to talk about, the real pain and discomfort. And honestly, the problem, especially from a medicine standpoint, is the stigma, right? There's a lot of stigma. We have a lot of stigma for pain in general, but we have a lot of stigma for my sickle patients, right? And of course, me being African American, right? Like I take that a little bit more personal, right? Yeah, because I got to, right? Because again, like I can't remember the last, for example, I have never treated a person with sickle cell disease who was not African American, right? I just never have. I know there's other people who got it, right? Like I know there's other people who got sickle cell disease. I've just never actually treated one with it, right? So when I do take care of the ones, what's going on? I see everybody. You know what? I told you I'd be forgetting. See, I've been forgetting that. See, Facebook Live changed the way where I used to be able to see like when y'all join. Let me see. All right, my brother Steve on here. Shout out to my brother. Oh, shout out Devil. What's going on, bro? All right. See, I used to be able to see like when people join, but like I gotta like swipe a whole new menu just to look. Okay, so I see. Oh, and my wife's on here too. Hello, Maria. Thank you for joining the live stream. We caught it late, but again, I'm just kind of going into, the conclusion, and we're going to talk about the podcast again. Conclusion again. We talked about why sickle cell disease is important, because it's Sickle Cell Awareness Month, right? Like if you don't think this is important, like any other month, you should at least think it's important this month, right? So sickle cell disease, important disease, focus on it this month. If you know anyone who has sickle cell disease, reach out to them, tell them, hey, I feel your pain. If there's anything I can do, let me help you, right? Because they go through a lot. So I can tell you they go through a lot, especially from an outpatient and inpatient perspective, right? So definitely some issues that we always got to talk about with them. We talked about what sickle cell disease is, some complications and some treatments. And then tomorrow on the podcast, we're going to go a little bit more in depth on the pain aspect and what the patients feel going through it. What a physician, treating sickle cell disease, like what's the outlook on that, right? And we're focused on that just kind of in general. We're going to talk about some personal, how has it shaped my treatment, especially from a personal standpoint and, patient case and everything else in that regards, right? So, appreciate you joining the late night Lunch and Learn. I know a lot of y'all are going to catch this later on, so whenever y'all do, I appreciate you for joining. Again, this is episode 51 of the Lunch and Learn. Much appreciated for all the support. Thank you for the likes. Thank you for the shares. You guys have been much, the rock, right, in everything that's Dr. Berry related, right? Like I said, as for now, I'm not gonna shout his name out because I don't know if you want his name out there. But I always see my friends around, because for those who know, I'm from Lake Worth, right? And I stay in Lake Worth. So I always see friends around, and the first thing they say, "Oh, Barry, man, I see what you're doing, man," and like that just like makes my day, right? Because again, a lot of times, you do these things, right? And I always tell my physician friends, right? Like you got to remember that the reason why you went to medicine, I hope, right? The reason why you went to medicine, right, is because you want to help people. And even if you can't get that instant gratitude, you got to know that someone out there is being like immensely helped, right, by what you're doing, right? And that's why I like doing, everything we're doing with the blogs, the videos, and everything else, right? Because even if I can't physically say thank you, right, that's why I try to shout out all the people who support. even if I can't shake your hand and say thank you, hug you and say thank you, we know it's getting out there, right? So it's much appreciated. Again, shout out to my brother I met yesterday at Sam's Club. You know who you are. Again, I don't want to put your business out there because I don't know if you want your business out there. In that regards, right? So y'all have a great, blessed evening. Podcast comes out tomorrow, probably like 7 in the morning, something like that. I don't know. Podcast out tomorrow. Lord, enjoy that. Listen to it. For all of my folks in South Florida, be careful. Like I said, Hurricane Irma is on its way. We don't know what it's looking like. For those, I'm from South Florida. I've been through, hurricane season over and over and over again, right? So, we don't get as hype about these hurricanes. Not to say that we're not concerned about them. We just understand, like, hey, yes, I can't get super hype for this one because one's coming right behind it, right? Because that's what hurricane season is all about, right? Hurricanes that just keep coming and coming and coming. So, protect yourself, get to shelter if you need to get to shelter. I work at Wellington Regional Hospital. And I'm on call, I forget which day I'm on call. So again, if you end up in the hospital, Wellington Regional, hopefully not too bad, but if you do and you see me, I'll be there. So I'll be taking care of you. So y'all guys have a great, blessed evening, and I'm gonna see y'all next week for the Lunch and Learn. Like I said, if you have not, go ahead and subscribe to the listserv. If you have not, go ahead and subscribe to the podcast. Go ahead and go ahead and share, because you guys keep me doing what I do. Y'all have a blessed evening. Bye.